During the Renaissance, a period of renewed interest in art, science, and humanism spanning roughly the 14th to the 17th centuries, personal hygiene and oral care were surprisingly varied and sometimes rudimentary, reflecting a mix of tradition, emerging knowledge, and cultural norms. While modern toothbrushes as we know them were not yet widespread, people employed a variety of methods to clean their teeth or managed their dental health in other ways, sometimes with limited success. Some of these practices had deep historical roots stretching back to antiquity, while others began to take shape during this era, influenced by the gradual spread of medical knowledge and changing social attitudes. One of the more practical and widespread tools for oral cleanliness during this time was the use of chewing sticks. Chewing sticks were small twigs or sticks, often taken from aromatic or otherwise medicinal trees such as the olive tree, the rosemary bush, or sometimes the miswak from the Salvadora persica tree, which had been in use across various cultures for centuries. To use a chewing stick, a person would fray one end of the twig to create a brush-like texture, then chew on it to produce fibers that helped mechanically clean the teeth and gums. Not only did this method help to scrape away food particles and plaque, but some botanically specific sticks may have also had mild antiseptic properties due to essential oils and natural compounds within the wood. Although chewing sticks originated and remained a tradition in parts of the Mediterranean, the Middle East, and Africa, they were also present in Europe during the Renaissance, particularly in regions where importation of such goods was possible, or where knowledge of their use traveled through trade routes and scholarly texts. This practice was often more common among lower social classes, while the wealthy might have opted for more elaborate, or sometimes less effective, means of oral care. Despite their simplicity, chewing sticks were an important oral hygiene tool, and their use highlights how people sought practical solutions to a universal problem long before modern toothbrushes. Another historically notable and intriguingly different method, embraced by some during the Renaissance, involved rinsing the mouth with wine. Wine, particularly red wine, was sometimes used as an oral rinse due to its alcohol content and acidity, which were believed to cleanse the mouth and freshen the breath. Medical texts from the period occasionally recommended swishing wine or vinegar mixtures to reduce dental pain or keep the mouth clean. While today we understand the limitations and potential harm of such acidic solutions, long-term use could erode tooth enamel. The employment of wine as a mouth rinse illustrates how early modern Europeans made use of readily available substances they believed had health benefits. The use of wine rinses also intersected with the cultural and social practices of the time. Wine was a common beverage across social classes in Europe, often safer to drink than water because of its fermentation process, reducing harmful pathogens. Its availability made it a convenient choice for a folk remedy, with medical practitioners and apothecaries sometimes prescribing diluted wine rinses, combined with herbs or spices to improve oral hygiene or reduce halitosis, bad breath. The Renaissance also saw a growing awareness of the social importance of fresh breath. Bad breath was not merely a personal inconvenience. It had real social consequences, especially among the upper classes who placed a high value on manners, appearance, and cleanliness as outward signs of status and refinement. Pamphlets and treatises on etiquette from the 16th and 17th centuries sometimes included advice on how to avoid unpleasant breath, recommending practices such as chewing aromatic herbs like parsley, mint, or sage, or sucking on dried fruits and sugar-coated almonds. These methods aim to mask rather than treat underlying dental problems, underscoring a gap in contemporary dental science. The cost of bad breath extended beyond simple social embarrassment. In tightly integrated Renaissance urban centers and aristocratic courts, personal reputation was crucial. Poor hygiene could be interpreted as a sign of moral laxity or sloppiness, which in turn could influence marriage prospects, business dealings, and political alliances. Religious writings occasionally linked physical purity with spiritual cleanliness, adding another layer to the cultural pressures surrounding body odor and breath. The demand for breath fresheners supported the nascent market for personal grooming products, including early tooth powders, pastes, and breath mints, precursors of modern toothpaste and mouthwash that would be developed much later. However, despite these practices and concerns, dental problems were widespread among Renaissance populations. Cavities, periodontal disease, and tooth loss were common afflictions exacerbated by limited effective treatments and the dietary patterns of the time, which often included high sugar content from honey, dried fruits, and the increasing availability of refined sugar in European diets. Without professional dental care or modern preventative measures, many people suffered oral pain and decay that was difficult to manage. Dentistry, as a profession, began to take higher formality during the Renaissance, influenced by advances in anatomy and medical knowledge emerging from the period's broader scientific awakening. However, this was more the exception than the rule, as most people relied on home remedies, barbers, and general physicians for dental issues, until later in the 17th and 18th centuries, when specialized dental practitioners and rudimentary instruments became more common. Overall, the Renaissance approach to oral hygiene was a complex interplay of inherited ancient practices, emerging medical thought, social customs, and practical challenges. Chewing sticks and wine rinses were tangible manifestations of people's efforts to maintain cleanliness and oral health, despite the limitations of contemporary knowledge. The concern over bad breath was not merely cosmetic, but tied to wider social values, reflecting how appearance and health began to intertwine more prominently during this era of cultural transformation. Understanding these practices provides valuable insight into how Renaissance individuals navigated daily life, balancing tradition with innovation as they sought health and social acceptance in a changing world.